welcome to Roskia for more health tips.
And today's discussion is on taking drugs the right way. When a drug is prescribed to you by a doctor, it is important that you follow the correct dosage frequency to ensure that you are not taking too much of the drug or too little of the drug. This is because taking a drug dose too soon could lead to too high levels of this drug in the blood. And this is what we call bioavailability. By bioavailability, I mean the amount of active drug that gets into your circulation ready for distribution. Again, waiting for too long between drug doses could lead to lower levels of this particular drug in the body, thereby preventing the drug from working properly. And before we proceed, let us try to understand what is a drug.
A drug is a chemical substance which, when ingested or introduced into the body, has physiological effects on the living organism. And today, our focus will be on medicine, which are therapeutic drugs used to prevent and treat diseases in living organisms.
And to ensure that a disease is well prevented and or treated, doctors prescribe drugs following certain and give certain medication orders. Some of these medication orders include a start dose. A start dose, this is a drug that should be given to a patient as soon as possible, only once, and usually during emergencies. Then we have a single dose order. This is a drug that should be given only once to a patient. And then we have PRN, drug medication order. This is a drug that should be given only when necessary. For instance, people with chronic pain are required to take painkillers only when they have pain. And then we have a drug order that is indicated as Nocte. This is a drug that should only be taken at night. And then we have studying order, medication order. And these are drugs that are given for several times in a day. And they include a drug that should be taken once in a day or 1 times 1, a drug that should be taken twice in a day or BD or 1 times 2, and a drug that should be taken thrice in a day or 1 times 3, and a drug that should be taken quarterly in a day or 1 times 4.
For a standing order, 1 times 1, it means you're supposed to take that drug in every 24 hours. For instance, if you take a drug at 7 a.m., you're supposed to take the same drug at 7 a.m. the following day. For medication order, 1 times 2, BD, it means you're supposed to take the drug after every 12 hours. For instance, if you take that drug at 7 a.m., the next time you're supposed to take that drug is around 7 p.m. The other medication order is 1 times 3, which is TID, which many of people have come to realize have that mistake of taking it the wrong way. Most people take it after, like the first time they take it after breakfast, the second time around 8 p.m., the second time they will take it around 12, and the last time they take it around 8 p.m. without following the necessary way, the right way, I mean. I want to correct that, you're supposed to take this drug after every 8 hours. If you take that drug at 7 a.m., the next time you're supposed to take that drug is at 3 p.m. and the last time you're supposed to take at 11 p.m. That's a correction that I hope everybody will correct.
Sure, Pauline. Thank you so much.
Yeah, and the other medication order is 1 times 4, QID, which means you're supposed to take this drug 6 hourly. For instance, if you take that drug at 7 a.m., the next time you're supposed to take it is at 1 p.m. The other time you take it is at 7 p.m. and the final time you're supposed to be taking at 1 a.m. Yeah, those are the different medication orders.
And also, guys, do not forget to deworm yourself every 3 months. And I've come to realize that people, when they are deworming themselves, they are usually given this drug, albendazole, which is common in our shelves over the counter. And when people buy this drug, they tend to take it very early in the morning before they ingest anything. They take it on an empty stomach. I want to correct that by saying that albendazole is effective when taken with food, and particularly if you could be able to take it with fatty foods. This is because fatty foods or taking this drug with food increases its absorption, hence increasing its effectiveness. Kindly correct that mistake. Be taking albendazole if it is albendazole that has been prescribed for you or you bought it over the counter. Take it with food.
Yes, thank you for watching this video. Kindly subscribe, comment, and like our video. All our videos are in YouTube. And also turn on your notifications so that you can be notified on when we are uploading the video. Welcome and
Thank you for watching, guys. We love you so much. Join us on Facebook at Rose Care. Thank you.